Choosing the right formula can feel overwhelming with dozens of options on the shelf. But here's what formula companies don't want you to know. The differences between most formulas are actually minimal. I'm about to simplify formula feeding and save you money and stress. Whether you're formula feeding by choice or necessity, I want you to feel confident in your decisions. Today, you'll learn how to choose the right formula, prepare it safely, and recognize when your baby is thriving. Let's break down the three main types of formula. Standard cow's milk-based formula works for about 80% of babies. These contain whey and casein proteins that are modified to be easier to digest than regular cow's milk. Partially hydrolyzed formulas have proteins that are broken down into smaller pieces. These are marketed for fussy babies but aren't necessary unless recommended by your pediatrician. Extensively hydrolyzed or amino acid-based formulas are for babies with true milk protein allergies, but this only affects 2 to 3% of babies. Here's the truth. All FDA-approved infant formulas meet strict nutritional requirements. The expensive brands aren't necessarily better than store brands. Many store brands are made by the same manufacturers as name brands, just with different packaging. Start with a standard cow's milk-based formula. Don't switch formulas unless there's a medical reason. Common baby fussiness, gas, or spit up usually aren't reasons to change formulas. These are normal baby behaviors. Formula safety is crucial. Always wash your hands and use clean bottles and nipples. If your water is from a private well, have it tested. City water is generally safe, but you can use bottled water if preferred. Follow mixing instructions exactly. Too concentrated can strain your baby's kidneys. Too diluted doesn't provide adequate nutrition. Mix formula with water first, then add powder, not the reverse. Prepared formula can stay at room temperature for 2 hours, in the refrigerator for 24 hours. How do you know your baby is getting enough? Look for these signs. Steady weight gain following their growth curve, 6 to 8 wet diapers per day after the first week, regular bowel movements. Remember, fed is best. Formula feeding can be just as bonding and nurturing as breastfeeding. Focus on responsive feeding, following your baby's cues, and maintaining that loving connection during feeding times. Formula feeding questions are some of the most common I receive. What's your biggest formula concern? Drop it in the comments below. Like this video if it helped, subscribe for more pediatric nutrition advice, and remember, you're doing great.